Good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton, Montgomery County. Thank you for being here today to where we can provide you an update regarding COVID-19. As we are all aware, the information is changing rapidly, and so we're trying to quickly distill the information presented at the governor's news conference and then bring to you relevant information for our community. So we were here yesterday, obviously, and we gave you an update on the numbers, and we indicated that those numbers would change, and indeed they have. So we're now over 125,000 human cases of COVID across the globe, 4,613 deaths. Again, those numbers will continue to increase. 1,215 cases in the United States, 36 deaths across 42 states. At this time, there are 5 confirmed cases in Ohio, and as Dr. Acton indicated on the press conference, or at the press conference earlier, 52 people within Ohio under investigation. And she indicated that at this time, based on all the available information, 1% of Ohio's population is carrying the COVID-19 virus. Those numbers will continue to increase. There are no confirmed cases at present in Montgomery County. But let's be realistic. Our assumption is that we have cases, whether they are confirmed or not, because we have been informed that we have community spread of the virus in this state. So we move forward from a planning and response standpoint with the assumption that we have cases. So for this pandemic, we are aggressively pursuing mitigation strategies, and we talked about those a little bit yesterday. And the reason we're doing this mitigation work, prevent the spread of infection. We know it's in the community. Let's limit how much it spreads. Reduce the peak number of cases. That way we minimize the burden to our healthcare system, our hospitals, and our critical infrastructure forces that need to continue to operate. And we talked about those strategies yesterday. Making sure families and citizens are prepared at home, do their part to stay healthy. Whether it's in the work environment or the home environment, let's make sure we're constantly cleaning indoor environmental surfaces. And then, specific to today as well, social distancing in multiple settings, whether it's at the university, school, workplace, and public-private settings. So, yesterday the governor had made specific recommendations and orders around a variety of social distancing measures. We knew yesterday, limiting visiting in prisons and youth detention facilities, remote learning for universities, spectator-free indoor sporting events at all levels, and we all understand where that stands right now nationally, postpone or cancel parades, recommendations for religious institutions, and then visitor restrictions in nursing homes. Today, the governor made very clear that there are further orders on social distancing. No visitors in nursing homes. No visitors in the state psychiatric hospitals. Limiting crowd size to no more than 100 people. And not distinguishing between public and private settings, nor indoor and outdoor events. All encompassing crowd size to no more than 100 people. We do understand, though, based on his comments, and we'll get this in writing once the order comes out, that there are exceptions. So airports, transportation venues, shopping malls, workplaces, religious events, restaurants, and First Amendment events. He also indicated at 2 o'clock, well, by the time the news conference started, that K-12 schools would be on extended break, and we have Shannon Cox, Superintendent of the Educational Services Center, here to provide some comments on the governor's decision. So we talked yesterday about recommendations for citizens, what we can do as individuals, as well as recommendations for all communities and workplaces. And I won't go over all those again today. You heard those yesterday. At Public Health, we continue to update this information. It's on our website at phdmc.org. Also, Public Health is opening an information line. We simply cannot we cannot respond to the volume of calls coming in. And oftentimes, even though the state has a conference line or call center, many of those calls are being returned to the local level. So we are, in an attempt to manage this initial surge, we are opening an information line tomorrow, 937-225-1000. 6217, and it will operate from 8 a.m. to 4 p.m. So, before we get into our next speakers, I think we need to pause for a moment to reflect on our collective vision of Montgomery County as a healthy, safe, and thriving community. So at Public Health, what we are doing is we are applying our guiding principles to achieve that vision. And that means we're centered on community. You see multiple partners here today. Public Health can't do this work alone. We're committed to equity. A lot of these decisions that are being made have the potential to disproportionately affect vulnerable, low-income individuals, individuals at risk. So we need to make sure that as we move forward, we're taking equity into consideration. We collaborate for impact. It's obvious based on who's here today. Everything we do, we operate with accountability, and we use evidence-based decision-making. So these decisions that are made on social distancing, both at the state level and then actions we take locally, are based on evidence. It's the public health evidence base. So let's ask ourselves, it's going to get pretty rocky, obviously. We're nowhere near ending this. We're thinking initially the best estimates are that this may continue to escalate until it peaks sometime late April, perhaps mid-May. So we have a lot of work to continue to do in this community. Let's ask ourselves, how will we serve each other and our community, show empathy and compassion for those less fortunate, treat everyone equally and fairly, and help each other? So when I look at those questions, the answers seem pretty simple to me. We're all part of the same greater community. Our charge is to aid, protect, and support each other as partners, as well as the community we serve. So thank you for being here today, and with that, I'd like to turn it over to Shannon Cox, who's the Superintendent of the Montgomery County Educational Services Center.
Thank you, Jeff. Good afternoon. As he stated, I'm Shannon Cox. I'm the Superintendent of the Montgomery County Educational Service Center. As part of the state's plan to contain the spread of COVID-19, Governor DeWine did a short time ago announce an extended 3-week spring break for all K-12 schools in Ohio, with a review by his staff April 3rd. This is for all schools in Ohio, public, private, and charter. Here in Montgomery County, the public school district superintendents have already been planning stages for what should happen over the next few weeks, knowing that we might be here in this moment. Our local school district leaders are innovative, they're dedicated to serving our students, and the #1 priority is safety. And so most of our local schools were already planning on some sort of extended break, knowing it might not be the best scenario for learning for all students, but it is the absolute right decision for protecting our students, their families, the staffing in our districts, and our community as a whole. Our school districts have put in place contingency plans such as online lessons or study packets in the event of an announcement from the governor, and so pieces of what's happening were already in play. Each of the school districts will decide what the best avenue of distance learning is for their district. Be sure to monitor your own district's normal means of communication, like their websites, their social media, for more information and further instructions. In education, we spend a great deal of time on creating the best learning atmosphere for our students. In this case, it's what is in the best interest of the students and their families and the school staff for their physical well-being. Distance learning is now the atmosphere handed to us by this pandemic, and our local school districts, with each solid leadership and innovative thinker that we have in each of these school districts, they will work through this delicate situation. Here in the Montgomery County Educational Service Center, along with many other organizations and entities within the county, we are here to help in any way as our school districts navigate through these different and fluid times. Thank you.
No, okay. Thanks, Jeff. Hi, I'm Dayton Mayor Nan Whaley. I want to first commend the Public Health Commissioner and their entire staff. They've been working nonstop since this became more and more of a reality over the past week, and appreciate Commissioner Cooper's leadership. And then also want to just appreciate for a moment the governor's great leadership in this. As we know, a lot of people can't see this we know it is here. And so appreciate both him and the Director of Public Health, Amy Atkins, for their great work and leadership as we move forward This afternoon, the city manager and I signed an emergency declaration. This will give our employees the opportunity to work from home from social distancing. There will be some disruption in the city of Dayton and non-essential city services, but trash will be continued to be picked up, and our safety services will, of course, continue. Our community emergency response table is already meeting as we begin to figure out exactly what this means for our community members as we close rec centers and make sure that people stay home. The governor banned gatherings of more than 100 people. The city is following this by rescinding all permits issued for any kind of gathering on public right-of-way or using any city services. We are working on figuring out how to help citizens facing financial hardship due to this crisis. We expect this will be an issue as the commissioner mentioned, people in low-income areas and people that are very short to the end with their dollars will have the hardest time with this crisis. That includes talking to Dayton Municipal Court about holding off on evictions, working with all utilities to discuss when residents cannot pay their utility bills. So we have to have those conversations because we know these pandemics affect people in different ways, and those that don't have means are going to be affected the most. We know many of our small businesses, God bless them, continue to go through and are going to be hurting for this as well. We want you to please use common sense about going out, but try to buy local whenever you can. Perhaps you DoorDash or do something, but please consider doing it with local businesses. I think it's pretty clear as I come over here every day and at 4 o'clock and the leadership of the commissioner that we are not in business as usual. And it's hard, I think, for folks to get their head around that, although probably the canceling of basketball is the best way to get anybody's attention in the city of Dayton and the Dayton region. But we need people to remember that just because you feel well and you're young and you're healthy, the decisions you're making will affect other people around you. So we're in this together, and the governor talked a lot about today at 2 o'clock about us acting patriotically. So that means making sure that you keep your distance from folks. It's very hard for me to say this as I am the largest hugger around in this community, but we need to make sure we aren't touching people as much, if at all, and to show our kindness in other ways. I know we're going to get through this. Dayton is well tested when it comes to crises. I think we pay close attention to each other, and we will come out of this stronger. Like we have every single other time, but we need to pay attention to those of our friends and family, but those of folks around us that don't have the means that we have as well. And I know we'll be continuing to do more work as we do this in the coming days, and we'll continue to keep the public informed as work develops. Thank you. Anybody else? All right. Questions?
What about, obviously, mass gatherings? That has been banned, but what does that mean in terms of restaurants and those being open in the future?
Well, I think if you saw the governor's press conference today and you saw the reporters, frankly, you all are standing too close to each other compared to the reporters said up at the State House, right? So trying to make sure that people are separate. So we're leaving that up to obviously each restaurant. There's this 100-person ban. But, we want to make sure, don't go into a crowded restaurant. It would make sense for you not to do that. We need people to use common sense about how communicable diseases work.
If there were more cases to develop here in Dayton and Montgomery County, are we equipped in terms of masks and things, or even tests, to test people if the number should grow here?
I think, and I'll let Jeff say it, we're as prepared as we can be, but we need the public's help right now to make sure that we keep this curve flat. And that's what we're trying to do so we don't overwhelm our health system.
Thank you, Mayor. So the specific question on test kits, every community in this state and across this country is asking that same question. We were notified on the governor's press conference that the Ohio Department of Health has between 1,200 to 1,500 test kits. There are also some test kits that private laboratories have in terms of the specimens that are submitted to them. It's really about the private physician and their clinical judgment as to whether or not a test is necessary.
Commissioner, any persons under investigation in the county right now?
As of from yesterday, I'm not aware of any update. But the reality is that's probably likely to change. The answer is 2, as I've just been informed.
This question for the superintendent. How are you guys going to help feed the kids
a great question. It's been one of our biggest concerns about what we thought was going to be the governor's statement, because we know that, as Mayor Whaley said, that many of our families who have the least are going to have the hardest time with this. So in addition to feeding, we also have the daycare considerations. I mean, it's a trickle down or trickle up effect, depending on which way you look at it. So we're going to try the best to use the resources that we already have. Many of the schools already have experience in like summer lunch programs. If you listen to the governor's press conference today, one of the suggestions was the philanthropic opportunity to provide sunshine in a bag or lunch book bags that they send home with kids, to really have those folks stand up and help each of the school districts. So each school district will handle this in their own way because they have their own demographic. But the school superintendents are already reaching out to folks, and we've already had folks reach out to us. For instance, right before I came over here, the Dayton Metro Library reached out and said, Shannon, how can we help? What can we do to help feed kids? What can we do to help make certain that these families, especially the families that need the most help, have what they need? So there isn't one clearly defined answer for that, and I apologize, but it's going to have to be up to each individual district to make that decision. But they will be making the decisions. We've been through challenges before. We certainly have never been through a pandemic. It's tested our resolve. We always come out stronger for it, and this will be yet another example of that.
What about students who don't have Wi-Fi at home or access to computers?
Yeah, absolutely. So, and that happens in every zip code, by the way, depending on carriers and different spots. So the good news is every school district already knows who those folks are. Because we have been down the online learning path for quite a while now. That's not anything new for us. And so they have been making, again, homework packets available, emails, because even if you don't have Wi-Fi, most parents do have access to some sort of email. So there is communication going on about what kinds of assignments can be done, and they don't always have to be online assignments. You know, picking up a good old book and continuing to read, we kind of have forgotten sometimes that that's probably one of the oldest lessons that we have. And so we're going to continue to make efforts to make certain that all of our learners continue their learning trajectory. Again, I cannot understate or overstate, cannot overstate the fact that this will be a disruption to learning. This is not the best practice for best education that we know, but it is where we are right now.
What kind of impact did this have on mandatory state testing?
So we're hoping that what the governor said today, I really appreciated his comments when he said we will ask for forgiveness later, because we're going to do what's best for kids and for families. And we will stand behind that comment every day of the week to make certain that we just take care of people first, and then we will make certain that their education continues.
Any kind of guidelines any of you have for preschools or daycare centers?
Well, I think if they're in the city of Dayton, we would encourage folks to close and figure out ways to take care of the kids. I mean, I think we're trying to keep people apart from each other. So that's what this is about. That's what the governor's talking about. Each situation is different. We're asking those daycare providers to apply common sense, but we need to make sure that we have social distancing going on.
Mayor, we have heard that there was a state of emergency for Dayton.
Mm-hmm.
What does that mean, and I guess is that true?
Yeah, I just announced it here, is what I said, that we have declared a state of emergency. We have signed it. That allows us to allow our workers to work from home, as well allows us to do other things as this pandemic moves forward in Dayton.
And I know you mentioned potentially closing off rec centers. When does that start happening, or is that, how will people know about this?
Yeah, go ahead, Jen.
So essentially, the first step is declaring that emergency. It puts the emergency infrastructure in place. So as we start seeing an elevated response, the city organization can continue to adapt, can have more flexible operations, and be able to continue to provide essential services to the public. Those decisions with regards to closing of rec centers, again, are heavily influenced by direction from the governor, and having a center that certainly accommodates more than 100 people is a problem. So we are working currently to assess as to when that closure happens, if it happens yet this evening, if it happens first thing in the morning. But we are going through all of our operations, trying to make sure we are in compliance with the directive the governor's office is providing.
How long might that city emergency order last for?
Well, as long as we have this pandemic, and, we'll take our cue again from the governor and the state of Ohio. So it's until we deem it no longer necessary.
Could that be several weeks? maybe
Oh,
months?
yes.
I'm sorry, Superintendent, one more question. I know the mayor kind of touched on it, but after school care, what do you want parents to know kind of about how that's going to be impacted?
Absolutely. So again, kind of goes back to the preschool question as well. If there are preschools or daycares or after-school providing provisions in the school systems, you can probably expect those to close at the same time that the K-12 schools will close, because they're all overseen by the same governance. It would be anything that would be private or the use of facilities. Those will have to be decided on a case-by-case basis. But I can't, again, these are really tough decisions because these impact families, care of families, and so these are decisions that we're gonna have to just work through them one by one. And all we can do is hope that everybody stops and looks at each decision and makes certain that it has the long-term effect that we're hoping for as a community, and not just, realizing the immediacy. But again, these are hard decisions.
Let's revisit real quickly your question on persons under investigation, because I think it's really important that we all have an understanding of where we're moving as a state and as a country. We heard earlier this afternoon that Dr. Acton from the Ohio Department of Health said there are approximately 52 people throughout the state of Ohio, persons under investigation. So as we identify a suspect case and/or individuals that person came into contact with, then we do contact tracing on that person, and that ring continues to build and build as we identify more and more people. Well, it's pretty obvious as the number of cases increases and as the number of persons under investigation increases, those actions are no longer sustainable. There simply aren't enough resources to track all those people. That's why we transitioned to a mitigation strategy around social distancing to limit the spread.
Can you talk a little bit about the economic impact? This seems like it couldn't have come at a worse time with the NCAAs and St. Patrick's Day and all the businesses affected.
Well, I don't think there's any good time for a pandemic. I do think that when people talk about this, I've heard a couple people talking in like the sense of what's going on in America right now, that this is like 9/11 level. I think that is correct. I think we need to understand that this is going to incredibly disrupt people's lives. We are really concerned about those that are living, barely edge to edge, particularly as we see people not participate in the economy as much. If we're asking people to stay home, what are they doing staying home? I mean, they might be buying some movies online, but generally they're not going to be spending money in the community like they were. So this is going to impact the economy. But I think what's important to note is we are very serious when we're trying to save lives here. And I think it's hard for us to understand that and get our head around that, since we're asking about where's the confirmed case. The Department of Health has said, the State Department of Health has said, we can anticipate about 1%, at least, conservatively, 1% have this. That means around 1,500 people already have this in the city of Dayton. About 550 people have it in the county. So we have to understand how communicative this is, that this is a virus we've never really seen before, that it is not like the flu in the sense of how communicable it is and how deadly it can be. So I think we recognize that we're going to have some economic issues when we get through this, but we have to get through this together by making sure that we keep each other healthy and we pay attention to the recommendations by doctors and health professionals in this community, in this state, and across the country.
Continuing with public health breakdown, the disease characteristics a little bit more, so you can really explain to readers why this is not like the flu or things they're familiar with.
So we're going to ask our medical director, Dr. Michael Doan, to come up to where you hear directly from a medical doctor.
Sorry, I didn't hear the question.
Go ahead.
I was wondering if you could break down the disease characteristics a little bit more, so you can explain to readers really well why this is not like the flu or things they're familiar with.
There are a couple of differences, okay. One, it's more transmissible than the flu, and it has a death rate that's about 10 times greater. That is, with the flu, it's maybe 1 out of 1,000. With this virus, it's about 1 out of 100. With that being said, I think it's also important to realize that though this is a novel coronavirus that is new, okay, it's not entirely different than other illnesses, so that we can use the same approach that we might have with any illness. That is, if you're sick and you're not real sick, stay at home, take care of yourself, and get better, okay? If you're sick enough that you feel like you need to have some medical care, then talk to your physician or your healthcare professional and follow their advice. They may say, you're doing okay, it sounds like things are good, stay at home. If things get worse, let us know. They may say, let's see you, come into the office, and we'll do an evaluation. They might also say, that they want to refer you to someplace else. Whatever they say, I would follow that instruction. And if they want to see you for an evaluation, go into the office, do what they say, you get a history, a physical, and your healthcare professional will make some evaluation based on their professional experience. And they'll decide what kind of tests they might want. May check you for the flu, may check you for other respiratory viruses, might decide that they want to test you for the coronavirus. But your best chance to get good care is to go to the professional that knows you, get their evaluation done, and let them use their experience to guide you. Your own physician or healthcare provider is really in the best position to try and do what's best for you. And so I think that that's important. So that, again, this is something new, and it's worse than the flu in a couple of ways, but it's not that different in terms of how we as people ought to go about trying to take care of ourselves. If you're really sick, you need to get care. If you're not too sick, what do we usually do? We stay home, we take care of ourselves, we see how things go. And some of the people that are sick are going to have this virus. Other people are going to have the flu. Other people will have something different. If we need to figure that out because you're sick enough, the doctors can do that. If not, take care of yourself the same way, and you'll get better. Does that help? Okay.
About the early symptoms, doctor, and like what people should be looking out for to start to maybe think about isolating and getting help.
I think it's the same things. I mean, fever, cough, shortness of breath. If you can't breathe, the American Lung Association used to say, when you can't breathe, nothing else matters. If you're to that point, you need to get help. Okay, but it's the same kinds of the same kinds of triggers for people should be what they've used previously when they've been sick. People pretty much know their own bodies. They know if they're sick. Okay, and if you're sick and you need help, then you need to call your doctor and see about getting some. If you're sick, but I don't know, I can take care of this at home, and you're kind of feeling all right, then stay home. Don't take a chance in giving somebody else the flu or something else, and take care of yourself the way that you normally would. Get plenty of rest, eat well, and if it gets worse, get some help.
Can it take a while for the symptoms to appear? 'Cause I know we've heard some people, they didn't think that they were sick, and then turns out they've had it for several days or even a week. Does it take time?
I think we've all had that experience, haven't we? That we're a little bit sick and then we get worse. Okay, we've certainly all seen that in our kids, I think. And so yes, that can happen. And so it takes monitoring yourself, but not being alarmist and thinking every cough and every cold is going to be something bad. Thank you.
Thank you.